Far and away the best treatment that we have for hot flushes, one of the most annoying symptoms of menopause, is estrogen. And really nothing works as well as estrogen therapy for menopause. But there are some women who either can't take estrogen, can't tolerate estrogen, or aren't willing to take estrogen because of the worry of side effects or long-term problems. And for them, there are some other prescription medications that can be used for hot flushes. So I'd like to talk about some of the medications that do have data for use in hot flushes, although none of them are specifically FDA approved for that use. Probably the most effective is clonidine. Clonidine is a blood pressure medication that can be used for the treatment of hot flushes, and there are studies that show that it can be quite effective. The problem with clonidine is because it's a blood pressure medicine, it tends to lower people's blood pressure, which can give side effects like dizziness or even nausea, or in some cases heart palpitations. But there is a patch called the clonidine patch that has a much slower release of clonidine and tends to have less of the side effects. So if you need an antihypertensive, if you have high blood pressure and you have hot flushes, clonidine might not be a bad option, as not only will it lower your blood pressure, but it might also help your hot flushes. If you don't have high blood pressure, you're probably better off with the clonidine patch, as you'll have much less side effects from that. So that's one option that is a prescription medication besides estrogen that has been shown to help hot flushes. Another option are certain antidepressants. Some of the so-called SSRIs and some of the other newer antidepressants have been shown to decrease hot flushes in women going through menopause. Some of the ones that have some effectiveness are Celexa, Lexapro, Effexor, and Paxil. All of those have shown to have some effect, although short-term studies do seem very promising. Some of the long-term studies show lesser effect on hot flushes over time. However, those are some medications that do have some data that they do relieve hot flushes. Now, interestingly, some of the other SSRIs, for instance, Zoloft, has not been shown to be effective against hot flushes. So you have to be careful which one that you choose. Finally, there's another drug called gabapentin, also called Neurontin, and that does have some promising studies that show that it can be very effective for women with hot flushes. The long-acting gabapentin was recently not approved by the FDA for an indication for hot flushes. The short-acting medication is available for other uses, and there is some data that it does decrease hot flushes, however, again, not FDA approved. That medication generally needs to be taken 3 times a day, and it can have some significant side effects. But it is another choice for women that can't take estrogen that want a prescription medication for hot flushes. So once again, the best medicine for hot flushes is estrogen, but for those women that for some reason aren't able to or don't want to take estrogen, then medications such as gabapentin, clonidine, or certain antidepressants can help with the hot flash symptoms.
Medtwice.com